Hi.
Hi, I'm Dr. Ramya Valiveru. I'm a breast and endocrine surgeon. Let us understand what is breast self-examination. It is a step-by-step method by which a lady is taught how to examine her own breasts and underarms to detect any breast cancer-related changes early. So what should be done in a breast self-examination and who should do it? Ideally, every lady who's above 18 years of age must start doing her breast self-examination. And when should one do it? They should do it on 5th to 8th day of their periods. And why is it like that? Actually, breast is a hormonally very active tissue. So before periods, when the hormone levels are on the higher side, the breasts tend to be a little tender and they may feel lumpy. So that is the reason why every woman should examine her breasts after her periods are over on the 5th to 8th day. So if a woman has stopped menstruating or if the periods are irregular, then a woman can do on a fixed day every month. So there are two steps for breast self-examination. First step is to look for changes and second is to feel for changes. A woman should undress herself, stand in front of a mirror with the arms by her side and then see if there are any changes in the appearance of her breasts or nipples or if there is any obvious lumpiness or swelling on the breasts and in the underarms. Then she should raise her arms above her head and look for the similar changes. Then a woman has to press her arms on her hips and look for similar changes. The second step of this breast self-examination is to feel for any cancer-related changes. Then a woman should lie down with a pillow on the side that she is examining. Suppose if it is her left breast, she should place a very thin pillow under her back of the left and then examine the breast with her right hand. One should not press the breast like this. They should roll the fingers on the breast and go in a systematic manner covering all the areas and look and feel for any lump. And she should also look at her nipples if there are any pulling in of the nipples or if there is any nipple discharge. So by this method, regularly if one is able to detect any cancer related changes, it becomes easy to identify cancer related changes and treat them early.